So the majority of the time, patients don't actually feel any symptoms with high blood pressure. That's why it's called the silent killer. So really the only way for you to truly know if you have elevated blood pressure is to go to your doctor and get a wellness visit.
When we're thinking about blood pressure, we're talking about two different numbers, the systolic, which is the top number, and the diastolic, which is the bottom number. Both are important. When we're talking about normal blood pressure, we're talking about less than 120 over less than 80. When we're discussing elevated blood pressure, we're talking about a systolic blood pressure of 120 to 129 on the top and less than 80 on the bottom. And within hypertension, there's what we call stage 1, which would be 130 to 139 on the top or 80 to 89 on the bottom. If you have stage 2 hypertension, that's considered a systolic of 140 or greater or a diastolic of 90 or greater.
If patient is in the early stages of high blood pressure, for example, if the blood pressure is either borderline or it's on the low end of hypertension, usually we can either get away with lifestyle modifications, meaning if a patient loses weight, a patient follows a very careful diet, low in sodium and high in fruits and vegetables and things like that, or a patient, if we need to use a medication, can generally get away with taking one medication. Once we start to get to the higher numbers, it's harder to expect that just changing their lifestyle or taking one medication is going to lower the blood pressure enough to make a meaningful difference. And those are the situations where we start to have to use more than one medication, sometimes 2 or 3 or even 4 medications to get the blood pressure under control.
So the conversations that we have around blood pressure depend on really the risk that the person has for cardiovascular disease, because as we know, high blood pressure is one of the major risk factors for cardiovascular disease. But we address patients' blood pressure differently based on their risk status. So for instance, a diabetic who is at high risk for heart disease, we treat them actually as if they have heart disease, and we would like to aim for a blood pressure that's lower than a person who doesn't have that risk.
So important to know your numbers. You're not always at a doctor's office, so your doctor wants to know that when you're not there, you're still having controlled blood pressure. So if your doctor recommends that it's important, get a blood pressure monitor at home so that you know your numbers all of the time. And if there's anything you're concerned about, please call your doctor to let them know, because it's more important to treat your blood pressure than to let it go until the next visit.